Um,
Somebody's mic is open.
that was the television that was up. You should hear me now. Matt went to get a sandwich, and I let you in the meeting.
Oh, okay. You can hear me, right?
Yes, I can.
Perfect. Hey, good job, man. Go to the bathroom before you run out of time.
Hey, I'm gonna go get me a sandwich too. Shit, everybody else left. No, I'm good. All right. Yeah, we'll just leave this up and running. So
Yeah,
we're good.
the meeting starts in 5 minutes, and they're all leaving to go get food.
There's nobody here. Hey, local government.
You gotta love it.
Yeah, we'll mute everything though until we get started. Thanks.
All right, cool.
Tuesday, August 15, 2023. I would like to call to order the regular meeting of the City of Marina Council meeting. And Anita, can we please get a roll call?
Councilmember McCarthy,
Here.
Councilmember Vischer,
Here.
Councilmember Biala,
Here.
Mayor Pro Tem Medina Dirksen, Mayor Delgado.
We have a quorum, thank you. And City Attorney, are there any changes to the agenda for the closed session?
No, the closed session is as presented on the agenda.
Thank you. And now we'll open it up to the public comments. Do we have anybody here that would like to speak from the public on closed session? Not seeing anybody here. So we'll close public comments and we will adjourn now to go to closed session and reconvene the open session around 6:30 p.m. Thank you.
regular city council meeting. We had a closed session agenda, and our first order of business here is to ask our city attorney Heidi Quinn to summarize that for us.
Thank you, Mayor. Good evening, members of the council, members of the public. Tonight, the city council met in closed session on 3 items. The first item was the existing litigation, Frank Lambert versus the city of Marina. The council approved settlement in full for the amount of $42,500. It was a motion by the mayor with a second by Viala, and the city will make those further details known at the next meeting. As to the other 2 items, Los Animas Concrete and negotiations with Joe Vieiro, as to both of those items, direction was given to staff by council, but there was no reportable action taken. And that concludes my report unless you have any questions.
Paul Farmer, could you lead us in the pledge after a moment of silence? Thank you, Paul, for being a good sport. Okay, we're going to have Andrea Willer, our Recreation and Cultural Service Department Chair, Director, give us a recreation announcement. Welcome, Lisa, and thank you for all your contributions to our pump track opening. And our mission is to provide so in the background, then both of our volunteer hours preparing
Oh, thank you. Sorry. We also do monthly social rides. Those are primarily aimed at making sure that Fort Ord is accessible to people who may be visiting the area, maybe newly moved to the area, don't have a community yet, and we'd like to help form community for them out on the trails. And we always jump at the chance to be involved in any kind of community, whether events, co-sponsor, partner, that kind of thing. The 2 that we're primarily involved in every year is we actually put on Take a Kid Mountain Biking Day every year. That's coming up in a couple of months. And we're heavily involved in Sea Otter Classic. Many people don't know that we are part of helping with planning the course, prepping the course, and we staff well over 50 of the positions at the event during the course of the event. This year, I believe there's also a proposal to have a pre-event here at the pump track. So we've been invited to come and be part of those festivities as well. So the moment that we were approached as a possible opportunity to show a movie at the pump track, we jumped at it. We knew exactly what movie we wanted to recommend. Esperanto has been on our radar screen for a long time as a movie we felt would be good for the community, both in terms of inclusion and diversity, but also in terms of it being a theme around a universal language that's spoken with mountain biking around the world and across cultures. So that's what I think that's what this trailer is going to show us, right?
Ĉu vi povas klarigi kion al vi signifas la biciklo?
O sea, eso es muy emocional para mí.
I feel like the common language of biking is still like a different bond. There's still just a different friendship and a different connection.
いい言語は中心人のバンクロイフ公法学家。
どんな言語を喋ってようが人と人とをつなぐ。
Mountainbiken brengt mensen tezamen. Ik heb vrienden over heel de wereld.
Cheers, boys.
Hola!
Buenos días, buenos días.
Hola!
Det lleva y te enseña.
Du møter nye venner, nye kulturer og nye eventyr.
It gives you a way to look at the world through a different perspective.
Todo. Todo es todo.
Esa es la bicicleta para mí.
Biking doesn't care what your background is, what you believe in, what your preferences are. It's super important to have pieces that connect us and bring us together.
"言語は意思疎通に使われてきたもので、言葉である必要はない。
All right, hopefully that got your blood pumping and you're stoked to come out to the pump track and watch the movie with us. I want to thank Lisa and Morka. They're helping us out with some bike safety checks, a loaner bike and helmet program in case someone shows up and doesn't have their own bike. We will also have food vendors, a bike valet, so that if you bring a nice bike and you want us to take care of it while you're watching the movie, we'll do that for you too. And that's it. So I hope to see you on September 23rd. 5 to 7:30 is fun on the pump track, and then 7:30 the movie will start.
Okay. Thank you, Andrea and Lisa, for all the thought you put into this event coming up. More than just a movie, right? Which is a great movie, though. Thank you.
Thank you.
Most of us have heard about on September 9th. We're having a big extravaganza, a Martin Luther King Jr. celebration of the opening of a sculpture garden. And to go along with that, we'll have a free Southern buffet, sit-down dining for everyone, and pony rides and petting zoo and face painting, animal balloons. There'll be some volunteer projects, some kindness rock art with an MLK Jr. theme to it. Starts at 11 o'clock, kind of blends after Dad's Read. Every second Saturday of the month, we have Dad's Read held up by the Friends of Marina Library, at the library and outside the library. And so on this day, September 9th, which also is a second Saturday, we'll be piggybacking with Dad's Read starting at 10 o'clock. And then this event that I'm talking about starts at 11 o'clock. And the Dad's Reading, we're hoping to get someone from the Village Project in Seaside that's consistent with the rest of the day's theme. And inside the library, there'll be movies played with Dr. Martin Luther King documentaries and speeches during the whole afternoon. There'll be a special movie about MLK Jr. starting at 2:30 when our event is over. So it's kind of like a Martin Luther King Day, really just an excuse to get everyone together, to remember the kinds of sacrifices made by civil rights activists, and to do what we can to be fair and understanding of everyone's differences that we live with today. But it's just a good excuse for community spirit to happen in Marina. This is a $600,000 project that'll be finished with construction, started in February this month sometime. And it's a beautiful pathway, native garden, sculpture, granite panels with Dr. Martin Luther King's quotes on them engraved. It's just a wonderful, beautiful setting to have this event. And so we hope everyone comes out. We're asking everyone to RSVP because we're expecting up to 500 people. We want to plan appropriately for the right amount of food. So please RSVP. It's really easy to find on the city's website for that day, September 9th, from 11 a.m. till 2 p.m. All right, other council members have announcements? All right, then we'll move on. For the public to comment anything that's on the consent agenda tonight, or anything that's on your mind that's not on the consent agenda or on the rest of our agenda. But just so you know, one thing on the consent agenda, it regards Coastal Commission grant application. And we have a correction, a minor technical error. I'm going to ask our planning manager, Allison Hunter, to go over this consent agenda correction.
Mayor, council members and members of the public, just a quick procedural fix. And like the mayor said, this is just a technical error on item 10F1. Just to make sure that the resolution that hopefully your council will be adopting tonight reflects the accurate full grant amount that we will be requesting, which is $497,120, which matches the budget in the application packet. We had an older version here on your resolution. So that's it. Just a quick replacement.
All right. So it's a
Thank you.
$22,000 increased amount.
Yeah.
That was the error. All right. So now let's go first to the public that's here. You have 3 minutes if you want to come up and let us know what's on your mind. Welcome back, Phil. We haven't seen you for a while.
Yeah. True. Chandler Rowland. I'm a long-term Marina resident. I am appearing this evening to request the City Council to reject the MST Project Surf program for the construction of 2 new express lanes along 6 miles on the beach side of Route 1 between Marina and Sand City. The reason for the requested rejection is as follows. The California Coastal Commission staff rejection memo to MST dated 5/10/2021. The California Department of Parks and Recreation memo rejecting the project dating 4/11/21. This young lady has the material. 2 weeks ago, MST advertised in a national newsletter paper requests for proposals for hiring a construction manager to manage the surf program. In the general portion of the advertised proposal, MSC listed that they entered into contract already with Granite Rock for the 66 million, possibly 100 million tax dollars, 100% SURF project, that's state and federal grants. Prior to any final permits, MST does not care about public, environmental, and recreational issues, but I know Marina does. And part of the rejection as far as the Parks and Recreation memo was because of elimination of bike paths. Thank you. I'll answer any questions that you might like to ask.
Thank you very much, Phil.
Good evening, Mayor Delgado and City Council members. I'm here just to provide, share some information on some work we're doing in your community. So first, my name is Paul Farmer. If I look familiar, I was the CEO of the Salinas Valley Chamber of Commerce for 10 years. Last year, I moved over to the Monterey County Business Council to start a new program called Building Business Back. Building Business Back is a partnership with the County of Monterey and MCBC, the Business Council. Our purpose is to help businesses throughout Monterey County to recover from the pandemic. More broadly, when we had flooding or other emergencies that happen, what we do, we have a small team, but we help connect business owners with resources that may help them, whether that's grants or loans or other resources. So we've built a website at montereycountybusiness.com where things are easy to find there, but we're also happy to meet with people individually, business owners, to talk about what their needs are and how we can help them. Todos los servicios de nosotros están también ofrecidos en español, so all of our services, our staff is completely bilingual. We're happy to meet with people in Spanish as well. We serve all of the businesses in Monterey County with a special emphasis on those that are owned by women, minorities, LGBTQ+, and also if they're in an unincorporated part of the county as well. And what we provide, in addition to the website resource, is individuals who meet with people and talk to them about their situation, as I mentioned. Also, we do a series of free workshops that are conducted throughout the county. They are all also available on Zoom. They are all also interpreted into Spanish. We're doing an upcoming workshop here in Marina that I want to make sure that you all are aware of. It will be on September 7th from 3 to 4 p.m. I'll be happy to send the information to the clerk so that she can share it with you all. We're working with the Marina Chamber on that, and it's basically just a 1-hour session to meet with business owners to talk about resources that may help them, the employee retention tax credit, other things like that. We want to make sure that they're aware. There's a lot of stuff out there, but it's not easy to get through. One other thing that we've been doing with a number of cities, and we'd be happy to do that with the city of Marina as well, is offering satellite hours in your communities. So we'd be happy to work with the Marina Chamber or Lane and his team. And all we need basically is a place to meet, and we'd come once a month, have one of our analysts be there available to answer questions for people. So again, we're just here today. I'm just here, no mouse in my pocket, here just to make sure that you all know about our program, Building Business Back. We're here to support you all. Again, we're funded through the American Recovery Plan Act, so there's no cost to the city. Thank you for your time.
Thank you very much, Paul. Good to see you. All right, anyone else in person? I'm not seeing anyone rise, then we'll go to the virtual guests and give everyone another moment to raise your hand on Zoom if you'd like to speak and haven't. Okay, we'll go ahead and close public comment and move on to our consent agenda. Does any council member have any brief comments or questions on any of our consent items? Let's go to Councilmember McCarthy.
Thank you, Mayor. I just wanted to make a brief comment on 10F5, which is the Right to Repair Act legislation that we're being asked to support. First, I want to thank you, Mr. Mayor, for bringing this forward. As an amateur tinker, I'm always repairing everything in my house, and it's helpful when businesses provide the resources, repair manuals, things like that, to facilitate that. But I also just wanted to mention that there's another piece of legislation, SB 271, that specifically deals with the right to repair powered wheelchairs. So it's just another area that we may want to take a position on. This bill, I think, addresses mostly consumer electronics and those type of products, but apparently there's a huge market for, especially folks that are on Medicare, their wheelchairs break and they just have a really hard time getting them repaired in ways that are cost friendly. So those are my comments. Again, thanks for bringing this forward, and I look forward to supporting it.
Thank you. Let's go to Councilmember Biala.
Thank you, Mr. Mayor. This is regarding 10F1 on the Coastal Commission competitive grant application. In reading the evaluation criteria, the program priorities, there is an environmental justice section, and it says in 2016, the legislation passed AB 2616, giving the Coastal Commission explicit authority to consider environmental justice. And it's saying that we would be given some priority in evaluation for this grant based on, in part, an environmental justice aspect. So I just want to make sure that as the city applies for this grant, we do bring attention to the fact that we did suffer 2 years ago a setback in which the CalAm desalination project was approved with 20 conditions, and that even going forward, that this application for the grant should explain that some of the environmental issues, environmental justice issues still remain, and that this is part of our considerations as a city. Thank you, Mr. Mayor.
All right. Thank you, Kathy. Would someone like to make a motion regarding consent?
I make a motion to accept the consent agenda.
Okay, and I'll second that with the understanding it includes the technical correction that Allison gave us. Okay with the motion maker?
Yes.
All in favor, please say aye.
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 All right, the motion passed unanimously with the 4 of us present. And we'll move on to a public hearing regarding the comprehensive tobacco retail license. And thank you to those that are here to speak on this issue.
I can share my screen if you'd like.
Good evening, Guido. Guido is our director of the Community Development Department.
I can share my screen. So. Yeah.
Mr. Mayor, can I just clarify? I think, because I know the staff report says that we're going to open a public hearing for kind of both of the items at once. I just wanted to clarify that that's what we're doing. Even though we'll consider them individually, I think the idea was to give presentations on both since they're so closely interrelated.
Yeah. So we have the comprehensive tobacco retailer license and the smoke-free public place ordinance.
Good
Okay,
evening,
Guido.
Mayor. Good evening, Mayor, members of the council. I'll be presenting 2 ordinances tonight, and we also will have some assistance from the county health department, and I understand Councilmember McCarthy might also have some additional comments. So I'm really just going to go over the procedural, what we're doing tonight, and then county health can get into the nitty gritty about the tobacco related issues. So as I said, there are 2 ordinances before the city council for tonight. One is adopting by reference the county tobacco retailer license ordinance with a local amendment that tobacco product sales would be prohibited within pharmacies in Marina. The second ordinance is a smoke-free public place ordinance. Smoking would be prohibited in enclosed areas in the following places: recreational areas, service areas, outdoor dining areas, public event areas, sidewalks, and other public spaces. Why is this important? For the first ordinance, establishing similar procedures for tobacco retailing is important so there's uniform compliance and enforcement can be achieved throughout the county. And for the second ordinance, tobacco is the #1 cause of preventable death in the state of California. And the ordinance does support the Blue Zone Project tobacco policy. The city of Marina is party to the Blue Zone Project, and the aim of that policy is to limit vaping and tobacco use. So the recommendation before the council tonight is to exempt the ordinances from CEQA per section 15061B3 of the CEQA guidelines, and to consider and reading by title and waiving the first reading of the tobacco comprehensive retailer license and the smoke-free public place ordinance. So that concludes my initial presentation.
Okay, Guido and Lane, how would you like to handle this next?
I think we can have the county health come up and speak a little bit. And I also want to, while he's coming up, give a little context that this has been, the council's talked about this for a while, and it's kind of been on staff's work program. Councilmember McCarthy really kind of picked up the ball. Our staff wasn't rising to the top, and so he jumped in and really helped and looked at some model ordinances in other counties and really got the ball rolling on that. And so really appreciate Councilmember McCarthy really getting the ball rolling and the county and the zones getting involved.
Thank you, sir. Good evening, Honorable Mayor, Marina City Council members, residents, and staff. I'm Gonzalo Coronado from the Monterey County Health Department, the Tobacco Control Program. The Monterey County Tobacco Control Program provides technical assistance to the county as well as all the cities within Monterey County on tobacco-related items such as smoke-free housing, smoke-free outdoor areas, and also tobacco retail licensing. The purpose of the tobacco retail license is to reduce youth access to tobacco products, delay the initiation and use of tobacco products, and ensure compliance with tobacco-related laws. Tobacco continues to be the leading cause of preventable death in the United States. It kills more people, more Americans every year than cocaine, heroin, alcohol, homicide, suicide, and AIDS combined. As you can see, some of those that are dying are also people who are exposed to secondhand smoke. Tobacco use also leads to substantial healthcare costs in our communities and lost productivity due to illness and premature death. The figures that you see here are from a study conducted every 2 years from Dr. Wendy Max, a health economics professor from UC San Francisco. These findings that you see on this slide are findings from the California School Climate and Health and Learning Surveys. Additionally, ever since the Surgeon General report in 1964 that we're all familiar with, smoking rates have declined along all demographics, except for one area, and that happened 6 to 8 years ago, and that was with youth and young adults. And that was at the same time that vaping products, electronic cigarettes, and flavored tobacco products hit the market. We have two decades worth of data that show the overall illegal tobacco sales rate to underage youth in Monterey County at 26%. That is according to the STAKE Act, which is the Stop Tobacco Access to Kids Enforcement Unit at the State Department of Public Health. Most smokers start before the age of 18. The early initiation and use of any substance, not just tobacco, is a strong indicator of an increased probability of substance use disorder later in life. This underlines the fact that most smokers want to quit, but find it difficult to do so. This slide here has a few things. One is it has the county and the city of when they adopted the tobacco retail licensing ordinance. The number in the parentheses is the number of tobacco retailers in the jurisdiction. Monterey County was the first in 2012. It was modeled after Riverside County, which is very similar geographically, a very large area like Monterey County, and has a lot of cities, although they do have more cities than we do. And that way that the county administers the program on behalf of all the cities within the county. After the Board of Supervisors adopted the tobacco retail license ordinance, it invited all the cities in the county to adopt an ordinance that the county would administer on their behalf. Currently, there are over 300 tobacco retailers, and approximately 90% of Monterey County residents are covered by a tobacco retail licensing ordinance. Monterey County has the facilities and the system to implement and administer the TRL program on behalf of the city of Marina. We educate tobacco retailers before any enforcement activity begins. The Public Health Bureau administers the license application process. Our partners at the Environmental Health Bureau inspect all tobacco retailers at least once a year. And I might add that for the last 5-6 years, they have been hitting that number 100% of the time. Also, the Environmental Health Bureau provides retailer education at the site and corrects many violations on site. This is not to be punitive. It's if we can fix it there, we will fix it. And they also conduct youth tobacco purchase surveys. The main components of a strong tobacco retail licensing ordinance are that it requires an annual fee, which is sufficient to cover the costs of operating the program. That it also considers a violation of any local, state, or federal law to be a violation of the ordinance. And it also has to have significant penalties included in there, fines, temporary suspensions, and/or possible revocation of license. These findings that you see here are from a survey that was done by the American Lung Association. Over 80% of California voters support a tobacco retail licensing ordinance in their communities. The Centers for Disease Control has found that tobacco advertising, most advertising for tobacco happens at the retail location, in their parking lots, on the stores, inside the stores. And that advertising encourages youth to use tobacco. The Sheriff's Department youth tobacco purchase surveys found a 15% illegal sales rate to underage youth from 2019 to 2021. Not a great number, but it is an improvement over the 26% compared to the Stake Act data that I mentioned before. We look forward to working with the city in the implementation and administration of a tobacco retail license for the city of Marina. This concludes the presentation. Thank you for your attention. My colleague and I are here and available to answer any questions at the appropriate time. Thank you.
Thank you, Gonzalo, for a great presentation. Appreciate that. Okay.
Brian, did you have some things that you?
Yeah, I have a short presentation on the second ordinance, so we can either do that now and then address them separately, or, okay. So good evening through the mayor. I know this is a little untraditional, although we've done it before. I'm presenting to you today a presentation on an ordinance to address exposure to secondhand smoke, and it's modeled after ordinance language provided by the Public Health Law Center. While we wait for that presentation to come up. Sure. Okay. So again, this ordinance presented to you tonight is modeled after language from the Public Health Law Center. And this is an effort that's been in the works for over 2 years now in Marina. It's included numerous stakeholders, including local nonprofits, health organizations, city staff, and community leaders. Next slide. So in California, well over 200 cities, I think it's up to about 250 cities now, have addressed smoke-free outdoor places. The jurisdictions surrounding Marina have some type of smoking regulations, including Marina State Beach, which prohibits smoking on their beach areas. CSUMB to our south is a completely smoke, vape, and tobacco-free campus. And Monterey County prohibits smoking in outdoor areas such as parks and addresses other workplace tobacco policies. In terms of voter support, a majority of voters support tobacco and smoking regulations. According to a 2018 poll by the Center for Tobacco Policy and Organizing, over 72% of California voters support comprehensive outdoor smoking bans. And even more notably, just this year, the CDC released a study showing that over half of all US adults support ending the sale of tobacco products nationwide. Researchers have found that 26% of people exposed to varying levels of secondhand smoke had signs of coronary artery calcification, which is a sign of coronary heart disease. During 2015 to 2018, 20.8% of non-smoking US adults age 18 and over were exposed to secondhand tobacco smoke as measured by cotinine in the blood. And this statistic is really significant to me because it shows not only kind of this anecdotal exposure to secondhand smoke, but very real and medically measurable exposure that results in a change to the blood. So again, that's over 20% of non-smoking US adults exposed. A 2022 study indicated 34,000 premature deaths from heart disease in non-smoking adults who had been exposed to secondhand smoke. Next slide. So in terms of exposure risks, the prevalence of secondhand smoke exposure was greater for adults aged 18 to 39 at 26%, than those aged 40 to 59, which was 19%, and 60 and over at 18%. So what this shows is young people have higher exposure rates. Exposure to secondhand smoke was more prevalent among non-Hispanic Black adults at 40%, compared with non-Hispanic white at 18%, so over double there. Adults with some college education had a lower prevalence of secondhand smoke exposure compared with those with a high school education or less. And the percentage of secondhand smoke exposed adults decreased with increasing family income. And further, people with less education and income are less likely to be covered by smoke-free laws in their respective jurisdictions. So the American Lung Association generates an annual report card of all jurisdictions, and I apologize, I know this is a little hard to see, but Monterey County, unincorporated Monterey County this year as a whole received a C, and Marina is only one of 2 jurisdictions to still receive an F, scoring 0 points total on the report card. So the ordinance before you tonight does not address all the subject areas in this report card and won't alone result in achieving an A, but it's hoped that it would be a good first start. The objectives and benefits of the smoke-free place ordinance is to protect non-smokers from the proven harmful effects of secondhand smoke, protect the environment, including the Monterey Bay Sanctuary, vernal ponds, water sources, and others from harmful chemicals included in tobacco and vape products, and may also have the added benefit such as protecting our ecotourism industry and reducing fire risk. And of course, an objective or benefit would be to reduce death and disease associated with secondhand smoke. The ordinance, if adopted, would prohibit smoking in all listed places, and the list in number 1 here. And I might call special attention to outdoor dining, as many people don't realize that current state law does not currently prohibit smoking in outdoor dining areas. It would create a smoke-free buffer zone from any of the places listed above, and that is to protect people from the health risk associated with drifting smoke. This is based on research that indicates measurable amounts of exposure to non-smokers when within 25 feet. And finally, it would prohibit the placement of ashtrays within 25 feet of smoke-free areas, as it has been found many see ashtrays as permission to smoke. Last slide here deals with enforcement. I think it's believed that the city would benefit from a comprehensive public education and awareness campaign. This is most frequently coming in the form of signage, announcements at public events, support from city leaders, and just general awareness and newsletters, press releases, websites, Facebook, et cetera. Other communication venues that are used by the city. The goal really is to change the conversation. It's not to go out and proactively attempt to seek out smokers and punish them. It's envisioned that any enforcement will be complaint-based. Another way of thinking about this is that if no one is exposed to complain, it's pretty safe to say there will be no enforcement. What's exciting to me is this policy has been very carefully, has kind of taken in equity into consideration, both in terms of improving health outcomes among those disproportionately affected, but also ensuring that equity is considered in the enforcement side, focusing more on educational and awareness rather than criminal penalties. And that concludes my presentation. Next slide there. I'm happy to answer any questions.
Excellent job. Thanks for your initiative on this whole project.
Thank you, Mayor.
Okay, so now we're going to open a public hearing. And we'll start with those present personally. Come on up if you'd like to speak for up to 13 minutes, 3 minutes. Hi. There's a little button just to push so the audience can hear you at home too.
Oh, it's on? Okay, perfect. All right. Good Good evening, council members and mayor. Today, unfortunately, our youth could not make it. They have been here before. If you guys remember the youth with the blue shirts that say steps, but they did make sure to write a letter to you all. And I'm just here to read that on behalf of our program, of our Safe Youth Empowerment program. So I'm going to start off by reading it. So good evening, council members and mayor. The Safe Youth Empowerment Project is a program of sensory centers. Our goal is to prevent drug and alcohol usage among minors, reduce alcohol-related traffic fatalities, along with providing peer-to-peer education within our community. We would like to share our stance on this matter by supporting the prohibition of selling tobacco products like single-use e-cigarettes in pharmacies in the city of Marina. We are also in full support of the Tobacco Retail License Ordinance, closing all loopholes to SB 793. And then they also wanted to touch on smoke-free public places. And what they had to say about this was that this issue puts teens in a vulnerable situation to become replacement smokers or turn to more illicit substances by getting hooked on modern tobacco products. We would like to take a stance and support smoke-free public place ordinance by saying that we believe there are still many environments that are not smoke-free. This is concerning as there is health consequences for people that experience secondhand smoke. It is especially important to have smoke-free public places since there are families and younger children outdoors that can be exposed to chemicals from cigarettes as well as modern tobacco products. As youth, we find it unfair to face health issues without being tobacco smokers ourselves, and our community is facing the same issue. Thank you. Now, from my end, my name is Katia Gutierrez, and I'm the program manager for our prevention services here in the peninsula. I do want to say that we have served Olson Elementary School and Marina Vista Elementary School, as well as Marina High, with being able to get 5th and 6th graders educated in vaping. And we have been invited back time after time to be able to tackle this issue. So what I really ask from you all is, as we are helping in this issue and our preventative measures, I really ask for your help in the enforcement role so that we can all work together as a community and really have a safe and healthy place here in Marina. Thank you.
Thank you very much.
Good evening, Mr. Mayor, City Council members, city staff, members of the community. My name is Tanya Rose. I'm the Community Program Manager here representing the Blue Zones Project, Monterey County. It's wonderful to see this on your agenda this evening. Thank you so much to staff as well as Councilmember McCarthy, as well as these fantastic partners here that have continued to keep this this important topic front of mind and providing some tremendous detail. I won't reiterate some of the powerful facts that our colleagues here have shared, but of course, as you know, Blue Zones Project is here supporting all community health and well-being, and certainly taking action on a policy level regarding tobacco is fundamental in helping citizens in Marina here live healthy, happy, and long lives. As you've heard, putting ordinances like this in place is first and foremost going to be protecting our young people. We've heard representatives today sharing some of that. So appreciating that. City of Marina is one of the last cities in Monterey County to put a TRL in place. So hoping you all will step forward in a leadership, well, maybe not so much a leadership role in that, but fulfilling and carrying that mantle forward. I do want to acknowledge and appreciate the leadership that you are showing as it relates to limiting sales in pharmacies. I think that's something that other municipalities across the county may look at and hopefully follow that model. So thank you for including that. In terms of the smoke-free spaces, again, this is an equity issue. It's giving the opportunity for everyone to enjoy outdoor spaces in ways that are healthy and clean. I know the city is investing quite a bit in your parks. We've got this incredible pump track and many more I know in the works. So allowing folks of all ages, all backgrounds, all demographics, all abilities to enjoy those spaces without having smoke or any of the harmful aerosols is critical and important. So thank you for your action on this. You know, we represent a broad coalition of many entities and many of our schools. So thank you so much.
Thank you for all your hard work, Tanya. Okay, let's go to Bob Gordon. Welcome, Bob. Oops, I think Bob Gordon went away.
Nope, I am here.
Bob, you there? Okay, hi, Bob.
Hi, good evening, Mayor and council members. My name is Bob Gordon. I'm a member of Monterey County Collaborates and also a volunteer with American Cancer Society Cancer Action Network. As was mentioned by the health department, tobacco companies bring a terrible toll of addiction and death to local and county residents. And the tobacco companies do it by attracting young people with electronic smoking devices and many other nicotine products. Unfortunately, many of these deadly products find their way into the middle and high schools. But I'd like to focus on a provision that would create a tobacco retailer license that, among other things, would end the sale of all tobacco products in all pharmacies. Now, this would include pharmacies at 4 national chains, 2 of which, Walmart and Walgreens, continue to sell addictive and deadly products in so many communities across the state. But Marina could join 55 other jurisdictions in California that have completely ended the sale of every tobacco product in every pharmacy. This pharmacy provision works so simply by including simple language in a tobacco retailer license to exclude any store from receiving a tobacco license if the store is licensed by the California Board of Pharmacy, as those chain stores are. This would cover all 4 categories of pharmacies, present and future. 1, pharmacies and big box stores, as I mentioned. 2, pharmacies and supermarkets. 3, chain drug stores, and 4, if there were independent pharmacies. Community members and their elected leaders do have the power to decide that local pharmacies will not sell tobacco, and therefore the power to change what a pharmacy is for a whole new generation of young people. Cigarettes and pharmacies don't mix. Thanks for considering a strong tobacco retailer license.
Thank you very much, Bob. Let's go to Breathe California of the Bay Area. Welcome.
Hi, thank you so much. Hello, Mayor and Council members. My name is Sheila Fan, and I'm the Tobacco Control Project Coordinator at Breathe California. I'm speaking today on behalf of my organization and taking a stand as a public health educator to encourage council to ban the sale of tobacco and single-use e-cigarettes in pharmacies and prohibit smoking in unenclosed public spaces, as mentioned in the ordinance presented today. According to the Code of Ethics of Pharmacists, one of the key principles of practice is to promote the good of every patient in a caring, compassionate, and confidential manner, taking into consideration the health, safety, and well-being of each patient. It does not make sense to have tobacco products easily accessible at a location that provides medication. It should not even be a thought that tobacco products could be sold in a pharmacy. Tobacco continues to lead to a number of detrimental physical and mental health effects and conditions. People look to pharmacies to improve and support their health. Selling tobacco products goes against the important and growing role of pharmacists play in the community and its well-being. Regarding the second ordinance mentioning smoke-free public spaces, Breathe California runs a secondhand smoke helpline for which we work with community members who have reported run-ins and experiences with secondhand smoke exposure. From 2022 until today, we have worked on a total of 24 cases in the city of Marina where community members have stated that they have run into secondhand smoke in outdoor public spaces, such as in outdoor dining settings and in recreational settings. Now, these are just numbers that were reported. Imagine the number of individuals who have experienced secondhand smoke and did not report it. We have to care and consider the health of non-smokers' rights as much as we do smokers' rights. We cannot keep allowing one person's habit to affect another person's health through secondhand and thirdhand smoke. All Marina residents and visitors deserve to live, work, study, and play in smoke-free environments. By implementing such laws and policies to make our community smoke-free, we can protect all workers and patrons from the dangers of secondhand smoke, as well as reduce death and disease associated with secondhand smoke, motivate individuals who do smoke to quit, and also reduce the number of people who begin smoking. Thank you so much for your time.
All right, thank you, Sheila. We're going to go next to Poonam Solanki. Welcome.
Good evening, council members and mayor.
Hi, I'm Poonam Solanki, and I work with Breathe California as a tobacco prevention intern. I'm making my comment as the concerned individual and want to express my strong opposition to the sale of cigarettes and tobacco products in the pharmacies. As a physician, I can confidently say that I would never recommend for my patient to use the tobacco products. Any practicing healthcare professional would say the same. Tobacco products has been proven to be harmful and even deadly, causing extremely great number of health issues, including lung cancer, heart disease, and other respiratory illnesses. Allowing such sales, especially in pharmacies, negatively impacts public health by promoting diseases and burdening our healthcare system. It also encourages addiction among our youth and sets a harmful example. Additionally, the sale contributes to the environmental degradation through litter and pollution. I urge the City Council to prioritize our community's well being and consider implementing the policies that prohibit the sale of these harmful products. Thank you, Mayor and the Council, for your time and consideration.
Thank you very much, Prunam. Let's go to Grace Silva Santella.
Good evening, Mayor and City Council. I want to first thank Brian, Councilmember McCarthy. I know that I'm going to call Councilmember McCarthy Brian because I consider him a friend. I know that Brian has worked a number of months, put in a tremendous amount of hours into this ordinance language, and I want to express my appreciation for that work that he's done to lead the charge on that. I would assume, first of all, I'm in support of this language. I think, though, as with anything in a city, in this kind of ordinance language, enforcement. A lot of this is just going to come down to enforcement. I know that I'm down at Marina State Beach parking lot, and I can smell the smoke of people both smoking cigarettes as well as cannabis. The question I have is, would you, when you close this public hearing, give us all an idea of the various locations in Marina that would be considered public places that signage will be posted? I would assume that Marina Library, which currently has signage that has a limit. It says you can't smoke within a certain distance of the library, that now would be a completely, totally smoke-free setting. I'm assuming that the public location at the corner of Del Monte and Reservation, I believe we call it the Bill Ring Circle, where our city flag is, would be considered a no smoking public space, even though it is adjacent to a commercial building. As I recall, when that project was approved, that was that whole corner is a public space, not a privately owned space. So if you could please let us know what locations within our city will soon have signage, assuming you all support this, will soon have signage that says no smoking. I assume too, Vince DiMaggio Park, especially if anybody rents that room, well, regardless of especially, if this ordinance passes. And again, Councilmember McCarthy, Brian, thank you very much for the hard work that you put into this.
All right, thank you, Grace. And now let's go to Jeff Markham. Good evening, Jeff.
Good evening, Mayor. Thank you. And I'd also like to add my thanks to Councilmember McCarthy for all the hard work that he's put in on this. I have a question, which is, does the TRL encompass any form of nicotine delivery system? And also, just seeing the kids and walking down Patton, vaporizing is the #1 nicotine inhalation device that they're using. do we have any way to stop or control how they acquire them? Because I know a lot of them get them off market or either online. So just curious how we're going to address that issue as well. Thank you.
Thank you, Jeff. And we'll get to those questions after public comments over. Let's go to Camille Cummings. Good evening, Camille.
Sorry about that. I was speaking without being muted, without unmuting myself. Good evening, everyone. My name is Camille Cummings, and I'm with the African American Tobacco Control Leadership Council. I'm here because I wholeheartedly, as well as the AATCLC, support the ordinance to end the sale of all flavored tobacco products, including e-cigarettes. The African American community is heavily impacted by predatory marketing and is one of the groups that's most impacted health-wise from the use of tobacco products. So I really appreciate your consideration of this ordinance, and I hope that this is something that the city of Marina can quickly get enacted. Thank you.
Thank you, Camille. Let's go to Ann Wheelis. Hello, Ann. Hello, Ann.
Hello, thank you for all of the cues on my screen. Good evening, Mayor Delgado and City Council members. I am Ann Wheelis. I am co-chair of the Monterey County Collaborates, which includes the Monterey County Tobacco Control Coalition. And I'm also a member of the California State Advocacy Committee of the American Heart Association. I applaud you for the proposed tobacco retail license ordinance, which brings Marina into line with the majority of cities in Monterey County and with over 200 cities and counties in California. By adopting the county's ordinance within your own ordinance, flavored tobacco products and single-use electronic vaping devices, as well as traditional vaping devices, are banned. Data from the California Healthy Kids Survey conducted by the Monterey Peninsula Unified School District in middle and high schools in the 2016-2017 school year, which is the latest data that is available online, shows the following. 10% of 7th graders and 37% of 11th graders reported that they had ever used an electric cigarette or other vaping device. In contrast, 4% of 7th graders and 10% of 11th graders reported that they were current users of e-cigarettes or other vaping devices. In contrast, 1% of 7th grade students and 17% of 11th grade students reported ever smoking a whole cigarette, and only 1% of 7th grade students and 10% of 11th grade students reported that they were current cigarette smokers. This difference in usage between traditional cigarettes and electronic devices is concerning. 23% of 7th grade students reported that it was fairly easy or very easy to obtain cigarettes, as did 58% of 11th graders. And that speaks to the crux of the tobacco retail licensing ordinance. The city of Pacific Grove, where I live, adopted the tobacco retailer license ordinance in 2019. The district's California Healthy Kids Survey in 2021 was conducted in the second year of the implementation of that ordinance. The percentage of students reporting that they had ever smoked a whole cigarette or used a vaping device decreased in grades 9, 11, and non-traditional or community school students. The percentage of students reporting daily use of either cigarettes or vaping devices decreased in grades 7, 9, and in non-traditional settings. And the percentage of students reporting use of marijuana in vaping devices decreased also in grades 9, 11, and non-traditional settings. Licensing tobacco retailers and educating retailers, along with enforcement, reduces the illegal sales of tobacco. As a school health educator who worked with Marina High School staff and students before my retirement, I was very impressed with how the city cares for their youth and families and worked with the schools to make sure that students were safe. I applaud your concern and urge you to approve the proposed addition to your city code of these tobacco retail licensing ordinance. Thank you very much.
Thank you, Ann, for all that information. Okay, let's go to Mike M. Mike?
Hello, Mayor and Council. Yeah, I completely support this this ordinance. This smoking does absolutely no good for anybody. And there's cigarette butts everywhere, especially behind the library. When I was looking at the library area to get ready for a project back there, and the amount of cigarette butts back there is unbelievable. The beach. I don't know why any pharmacy would want to sell tobacco. I personally think it should go all the way to eliminating any sort of advertising signs in any windows or anywhere that sells tobacco products. I mean, if it was up to me, I would just eliminate all tobacco sales, but I mean, it's probably asking too much. So I applaud you for bringing this forward, and I hope we can catch up to the rest of the cities in Monterey County and put the squeeze on tobacco sales. Thank you.
Thank you, Mike. We'll give everyone else who hasn't spoken a moment to raise your hand if you'd like to speak. All right, let's go to Tommy Bolea. Welcome, Tommy.
Yeah, good evening, Mayor, City Council. Yeah, it took me a little to figure out that every time I go get gas in Marina, I never got a receipt. And then you go in the store to get the receipt, and that's when I'm exposed to everything. All those cigarettes. And I'm not a smoker, but I could imagine young kids getting their receipt for their gasoline and then getting exposed. I think that needs to be fixed because you're drawing people in. I figured out what they're doing there. They're getting you in the store. Now they got you because you're exposed to everything. But I think that should be changed too. I think cigarettes and everything should be hidden, shouldn't be advertised like that, especially for young kids near the pump track. You're going to start this whole cycle, and you're going to start them young because they go straight to 7-Eleven to go get their favorite drink, and they're exposed to all this. I can't even buy lottery. Where can I buy lottery tickets where I'm not exposed to cigarettes or things advertised in front of my face? I mean, it's just that needs to be corrected, I think. But I can't even go on the west side of Marina. That's all I smell now is marijuana and cigarettes, and I see cigarette butts. I mean, Marina's not a really healthy. I understand there's taxes involved and revenue, but you can hire all the firefighters, all the policemen you want, but when there's a 911 call, it's generally too late. You can't take back heart disease, lung cancer, or any of these other diseases. I mean, COVID really woke me up. I mean, to the point where I'm now eating better, things that I didn't know, but I never smoked. But luckily, I never had that addiction. But kids are always willing to try something new, and there's more of it. And they're being exposed to it in indirect ways by walking into a store, and the first thing you see is cigarettes. It's like free advertising, but I don't know, I would change some of that, but this would be a good start in changing with this ordinance. But, I mean, I can't even go to the beach sometimes, even though it's got a breeze, but when I smell smoke, I just leave. It's just, I'm not saying you can't do it, but I want to be in a smoke-free zone. And if I can't be on the West Coast or along the beach, then I'll go to Monterey or something. It seems, I don't know. It just, have a good evening.
All right. Thank you, Tommy. And thank you for your service at Knights of Columbus. It was good to see you last weekend. Anyone else wishing to speak, please raise your hand. All right. We're going to go ahead and close public comments. And we had some questions from Jeff. If this TRL that we're discussing tonight would have any effect on all delivery systems? Guido?
It's good to say, Guido, if you're in line.
Yeah, the ordinance does, but it's probably better if county health answers that question directly. And then
Gonzalo, thank you.
I have answers to some of the other questions as well. So
If I'll share my understanding of the question, if the tobacco retail licensing ordinance will cover all tobacco products, if that's correct, the answer is yes.
And then how about cannabis products?
No.
And then control of off-market purchases such as online purchases. Does this have any effect on those?
It's very hard to track down where something like that is going on.
Okay.
But one of the things we will be doing, because we've heard of this happening in our colleagues, especially in Los Angeles, where a retailer would stop selling for say flavors, and then somebody would come in, a young person would come in and they say, well, we can't sell it here, but order it on the app on this iPad that I'm going to lend you and come back in 5 minutes and you can pick it up. That's something that we would be against.
All right, thank you. That's all. Maybe for our city manager, police chief, a couple questions from Grace. What will happen to the library? You know, has signs right now saying within a certain distance you can't smoke, but now it's going to be throughout the park. So what happens to those signs?
Not positive if we've really identified all the locations, but our intent is all of our parks, including the library, we're going to make sure that we have signs out in prominent locations. But that'll be our next step if the council approves that, is we'll get all the appropriate signs out in all our parks, because if the signs aren't in the parks, people aren't going to realize it.
Okay, and then the Jack in the Box kind of public space, is that something that we control, that we can sign?
We'll look into that. I'm not quite positive on that.
All right, did I miss any questions others may have noted?
those are the ones that I noted, Mr. Mayor. So.
All right, thank you, Guido. So let's bring it to council then. Any questions or comments you have at this time? All right, let's go to Councilmember Vischer.
Thank you, Mr. Mayor. I also would like to start with thanking Councilmember McCarthy to get this on the agenda. Thank you. I fully support this. I'm glad that we have a chance now to do what the neighboring cities already have done in the county. I do have one question. It's also about signage. What needs to be written on the sign? Can it just be the symbol, or does it need to include language about ordinance? And that's what I would already thought. Can we please, yes,
get an answer to that question?
Guido, have you looked at that detail yet?
I have not, Lane, but we can certainly reach out to other cities and work with county health to get the appropriate signage. So,
more in general, police chief, with any sign like don't feed the wildlife or don't smoke, must there be a ordinance cited for you to be able to enforce it? Or parking or whatever it might be.
Yes, as far as, the signs that we're going to put up at the various locations is going to be due for public education at first, so we can get compliance that way. But if for some point that we have to take enforcement action, a sign with the ordinance will be effective for us, which staff is going to look into posting the correct signage that needs to be done.
Okay, so if a sign says please, or a sign doesn't list the ordinance number, then you can't effectively enforce it. You can educate, but you can't enforce.
We can't enforce. That's part of it doesn't have to be on the sign for us to enforce.
Okay.
Right. Just like the rest of the municipal codes, we don't have to have signs everywhere in the city to cite somebody.
Okay. Does that answer your question?
Yes, and then I do have one request.
Thank you.
Can we please try to design nice signs that we can maintain well, that are not like many of our other signs that, in a few years will be bleached out. So yes, but I'm totally in support, and I will take the signs if we have to so that it can be enforced. Thank you very much. Thank you, Mr. Chair.
Thank you, Elizabeth. Let's go to Councilmember Viola.
Thank you, Mr. Mayor. And I, of course, also support this wholeheartedly. When I look at this chart and see the county, Monterey County did this back 11 years ago. And so I am embarrassed that on the peninsula, we're 3 years behind the last city, which is Seaside at 2020. And I also thank Council Member McCarthy for pushing us forward into this. And I think that this council would probably be seen as completely supportive of this, but unfortunately the bandwidth and the attention was not there until Councilmember McCarthy was able to grab a hold of it. I want to ask our Gonzalo, if you could, on a medical question. I realize that we are completely focused on tobacco and not cannabis, but I just wanted to know, is there research in terms of the physical smoke causing cancer from cannabis versus tobacco? Do we have any information about that? Because, you know, we're talking about secondhand smoke, and I just don't know the answer. Many years ago, I think I had read some things published by the American Medical Association, but I haven't kept up on that.
I do not have the answer, but I have somebody with me that has a better chance than I do. I'd like to
Great.
introduce to you Michelle House, also from the County Health Department, Public Health Bureau, and she'll introduce herself and where she works.
Hi. Hi, good evening, Mayor, Council. Michelle House, Monterey County Public Health. I oversee tobacco, cannabis, and many other programs. To answer your question, I can get you some information, white papers. I can send them forward to you, but the real answer is smoke is smoke. So,
That's right.
you know, whatever you're smoking, it doesn't matter. It goes
really
into your
helpful.
lungs, it
Of course.
affects you.
Yes, great. That's very helpful to know, even though I know we're not focused on cannabis and it has
Correct.
very different uses and
Correct.
reasons for use, et cetera.
Correct. But
but
I would be
smoke-
happy to send you
I
some
would really,
information.
really appreciate that. Thank
You're
you
welcome.
very, very much. And I have some other questions as well. So when we look at secondhand smoke, even though we are talking about tobacco smoke, if let's say somebody is smoking cannabis in the parks, for example, it's still smoke, regardless of whether cannabis smoke is impacting the health status of that individual. But now we have enforcement and we just see smoke. But if it turns out upon accosting that individual that it's cannabis, then the enforcers really can't do anything, correct? I mean, if it turns out to be that and they just say, well, have a good day, and they have to walk away. Is that correct?
She'll come after me if I made a mistake. But state law, my understanding of state law bans, state law states that smoking of cannabis is prohibited wherever the smoking of tobacco is.
And I can also say you're not allowed to consume cannabis in public spaces. So if I am out at the park and I'm smelling, an officer is there, I think he knows where I'm going with this. If he smells the cannabis, although we are discussing this evening a tobacco retail licensing and outdoor tobacco ordinance, exactly what Gonzalo said, and I cannot consume. So when I say consume, I can't drink it, I can't take a gummy, I can't smoke it in public spaces.
Oh, great. Thank you very much. It's very helpful. So our signs, following that logic, then our signs can just have however we say no smoking, and it doesn't have to distinguish between any kind of other smoke, whether it's cannabis or tobacco.
Unless you put cannabis in your ordinance as part of your outdoor smoking policy. I mean, we've just stated that is state law, but some places will put, you may not vape, you may not use cannabis, you may not use tobacco. And they'll have a symbol for all three of those signs, kind of in the symbol on the signage. So for example, when we're doing, I'll just use this as an example, when we're working on smoke-free apartment complexes, we include that as part of the ordinance so that when people have an understanding of living in that apartment complex, they would not use smoking of cannabis in their own home. They may not smoke the cannabis, but they might use a gummy or some tincture or something else. And then part of that coverage of that would include the symbol with all three. That's under that ordinance. But in this case, it's state law, so it is a little tricky on how I think you would have to go about your signage. It is, but I hope that's helping.
Very much so. So I'm counting on Guido and our staff to kind of figure that out and do their research on it. So thank you very much. And one last question, this goes to probably our city staff. Outside of posting signs, do we have another plan of how we're going to disseminate the new ordinance prohibitions to our community? And if we've thought about other ways in which to reach out to the community?
I can answer that later if you want to, or.
Go ahead,
I
Guido.
was going to say, I also, hi, Michelle again. We at the county, after a tobacco, for example, with tobacco retail licensing, we will take it upon ourselves to educate and send all the information out to all of your tobacco retailers. And we have a team that works on that, and they will go out and physically visit. They'll mail things. They'll do it several times to make sure that all of the tobacco retailers receive what they need. They'll fill out the forms, they collect the fee from them, and we kind of call it welcoming you to the tobacco retail family. Welcome. And we do little welcome packets and we work with them. And then from that point on, after the first collection of the fees, then environmental health takes over after year 2 with the collection and going out and visiting. So from that piece, and then I think as your outdoor ordinance, you'll come up with ways to put on your website, maybe do a mailing to your community. These are just ideas that other places have done, like in the city of Pacific Grove.
Thank you for that information about very strong resources available for us. Because we're a little late, we have a lot of precedents to follow. Thank you so much.
Yeah, I was just going to mirror what County Health said. We would obviously work with them, and I did pull from finance all the tobacco license retailers in the city who are currently selling. So, and we would put it on our website, and the city manager has a new initiative where we're sending out stuff bi-monthly to the community. So we would use all of our resources. So.
Thank you, Guido. Thanks, Michelle. Okay, let's go back to Councilmember Bishop.
Thank you, Mr. Mayor. I have one additional question. Since recreational area means any publicly or privately owned area, it must mean that also parks owned by HOAs are included. And is that correct?
Who would like to answer that? Nobody's rising.
I didn't hear the question. I'm sorry.
So as I understand it, the question is in a private development that's privately owned in a public area, in a public park in a private development, is that covered? My sense is it's not, but the county may have.
I'm preface this by saying I'm not a lawyer. But my understanding, if it's public as far as access, I mean, anybody can go, nobody's telling me, hey, you can't go in here, and then it is public in that regard.
So that's something we probably want our police department or city attorney to follow up on so we get the right information.
Yes, because this is how I understood it. If I read it correctly under letter I on page 9, it's exactly how I understood it. And my question would, I would assume that staff, if this is the case, that staff will work with the owners, with HOAs, to make sure that the signs are designed the way they want it and the placement, etc. But thank you. I was hoping it would be included.
So maybe council can get an email from staff once you find out.
Yes. Thank you, Mr. Mayor. Thank you.
Okay, I'm a little ignorant here. I didn't know that pharmacies sold tobacco. Do pharmacies sell tobacco? If I go to the CVS summary pharmacy, instead of getting my medicine, I wouldn't buy cigarettes there, would I?
So in Marina, as was mentioned, there's 4 pharmacies. Don't think Walmart sells tobacco. CVS recently ceased selling tobacco nationwide, just within the last couple of years. And Walgreens, interestingly, still sells tobacco. But they were actually under a lot of heat from I think it was the FDA or the CDC, because there was some evidence that they actually were systematically selling to minors. So long story short, Walgreens is the only pharmacy that currently sells tobacco in Marina.
And is that in the pharmacy or is that in the retail shelves?
It's in the retail area, but it's still considered a pharmacy as a whole.
I see.
It's
Okay.
usually behind the counter.
Like the checkout stand.
Yeah.
Okay, so not in the pharmacy, but the whole of CVS is considered a pharmacy because it has a pharmacy? I didn't understand that. Okay. So we're like one of the last in the county to do this, and we have a pharmacy component to it. Do most of the other cities lack a pharmacy component to theirs? Okay, so it's like we're the little brother. We get to see what our older siblings have done, and hopefully we do things a little bit better in this regard anyway. Okay, great. So the County of Monterey, do they have a pharmacy component? So it came about after the horse had already left the barn as something that could be done. It just wasn't thought of before. It wasn't part of the encouragement by the advocates. I see.
You're a rebel. Don't you love that? I love that.
I've never been a rebel before.
Oh, Mayor, I love it.
Okay. All right. Okay, let's go to Council.
It's still on, but I do have a couple comments I just wanted to make, based off the comments I heard from council members. So with signage requirements, for the smoke-free public places, the only thing that the ordinance speaks to is when we issue an event permit, we would require that event permittee to put 5 signs up, that are basically photocopied signs, and the city would provide a template for that. And then I just thought it was kind of fascinating. I know we're here to talk about tobacco, but since Councilmember Biala did bring up cannabis, as I think was mentioned by members of the public, cannabis smoking in public has never been legal in California. Yet we encounter it all the time. We know that. I would anticipate that this smoking prohibition would kind of take a similar path. We're still going to witness smoking in public, and we're not looking to criminalize that. But this education effort of really saying that, reminding people that cannabis smoking in public is illegal. If we pass this, vaping and tobacco hopefully goes a long way into educating young people, starts curbing the use. And so I would hope that if the city does look at putting up signs, that we really have that discussion of using the cannabis symbol, as was mentioned, because that is current state law and is, in my opinion, likely to be state law for a long time. So, but it is interesting how many people I talk to that come to California that say, oh, it's illegal, right? Like, and there's no concept of, yes, it's legal and we're respecting your right to use cannabis, but under certain government regulations and conditions. And the last thing I'll say is, if this is passed today, I think it was mentioned, but there's still work to be done. I mean, this doesn't give us an A on the American Lung Association report card, but there's all these other policy areas that I hope you'll go back and look at and think about, what direction the city might want to move in. So those are my comments. Thank you, Mayor.
All right. Thank you, Brian. And I wanted to, like others, thank you, Brian. It's not very often that a council member takes individual initiative such as you've done on this. And as I think Kathy said, or someone said, you've been doing it for months, maybe longer, but it's above and beyond what you're expected to do. And so we really appreciate it. And other folks on our council on occasion have worked on initiatives. We had the bag ban. Kathy took the initiative to support the snowy plover and making that a mascot. Chickens were legalized. The roundabouts replaced non-roundabout intersections. So once in a while, we had mobile home rent control by Councilmember Brown and Councilmember O'Connell. Once in a while, council members step out of their normal group and take the initiative to lead, and it results in good things. Our bag ban and our styrofoam ban were also led by council members' initiative, but it's great. It's been a while since a council member has taken the initiative you've taken. So thank you very much, Brian. Okay. Would someone like to make a motion?
Be happy to make a motion that we introduce and read by title only, waiving further reading ordinance 2023 - adopting a comprehensive tobacco retailer license.
I second.
Do you want to do it as one? Okay.
Let me ask, can we do both at once?
You could do both as once through the mayor, as long as you're making it clear that you're doing the first reading of each ordinance and that's articulated.
Okay, Mr. Mayor, then I'd like to add to that, also consider introducing and reading by title only waiving the further reading of ordinance 2023 establishing a smoke-free public place.
Second hold?
Second hold.
All right, so we have two ordinances up for a vote. We'll have a roll call, please, Anita.
Councilmember Fisher,
Yes.
Councilmember McCarthy,
Yes.
Councilmember Biala,
Yes.
Mayor Delgado.
Yes. All right, so that motion passed unanimously, and thanks to all of our partners and advocates throughout the journey and being here tonight when you could be a lot of other places at the end of our workday. Appreciate it very much. Thanks for showing up. Unanimous with the four of us present. So just to be clear, that was unanimous with the four of us present because Christina couldn't be with us tonight. Good night, everyone. Thanks again. Okay, we move on to our only action item, which was listed on the agenda, but it's been continued to the future meeting, the future meeting, and that regarded a cell tower in the city of Marina, but that will not be heard here tonight. And so we'll move on. Is that correct, City Attorney? To the kind of house cleaning items, the Monterey County Mayors Association, they meet every month, all 12 mayors. And this month we did something a little different because we had our new Speaker of the Assembly of California, Robert Rivas, who asked to meet with us. And so we met on a Wednesday instead of a Friday at Salinas City Hall. And we spent a couple hours with Assembly Speaker Rivas. And I want everyone to know that we have the opportunity that we have not had before. Kind of believe it when you see it, but it appears that being that Speaker Rivas is the first in 40 years in California to come from a rural area. You know, normally it's either San Francisco or Los Angeles for the last 40 years, and that he grew up in Hollister. So he knows this area, he lives in this area, he comes to this area every week to be home, that we have an unusual access to the Speaker of the Assembly, who speaks a lot about the same issues that we deal with in our area. So in the next couple of years, the more we make the effort to communicate with his staff, the more likely we'll get progress that we want. But it's not business as usual. He doesn't approach things business as usual. So we'll see how it works out. But if we don't do our part in communicating to him and through his staff, then it's kind of on us if we don't get what we want. When it comes to water issues or homeless issues or affordability issues, he's with us, and we just need to keep him in the loop because he'll go where people tell him to go, just like we do. So it's up to us to step forward in that. And similarly, our Assistant City Manager, Matt Mogeson, and I, and the mayors of the county attended a Seaside City Hall meeting with Dawn Addis, the assembly person of our district, and much the same situation as Robert Rivas. She told us that she's very open and waiting to hear from us. And so, I think John Laird is fairly dependable on what, listening to us. So with our state senator and our state assembly person, and then the extra help from the assembly speaker, we'll see what we can do in the next couple of years, because it seems like the roadmap is a little different than it has been. All right, so now we come to the last thing before adjournment, reports on meetings and conferences by council members. I'd like to start off by complimenting Carolina Rivera and Andrea Willer. Andrea's here tonight from the Recreation Department and Cultural Services. They've worked really hard getting ready for the September 9th event. So if it's as great an event as we think it's going to be, it's largely due to their efforts. They're working every week on this, and there's a lot of moving pieces to it. So thank you to Carolina and Andrea for your contributions. Okay, any other folks want to report on any meetings? Or let's go to Councilmember McCarthy and then our city manager and Fisher. Councilmember Fisher.
Thank you, Mayor. I'll just add real briefly, I'm the representative on AMBAG, and at our last meeting, there was some discussion about that we will be looking at the regional growth forecast. And I think that's a forecast that happens every so many years, 4 or 5 years. And traditionally, they've always used employment as a metric to determine growth. And so this year, they're looking at 3 different models. They're looking at the traditional employment only based model, and then 2 other models that allow for a little bit more local input. And it sounds like the planner directors, and if Guido wants to chime in, you can, generally are favoring a model that allows for that additional input, because we know we have jurisdictions where employment, Carmel, for example, a lot of retired folks that aren't employed, and so that doesn't necessarily speak to their growth. So at our next meeting, we'll be adopting a model. If you have any input that you'd like to show, or if you'd like some more information, happy to send you a link to the agenda. So that's it for me. Thank you, Mayor.
Thank you, Brian. Okay, let's go to City Manager Lane Long.
I just want to let the council know that our new finance director, Laura Berneda, will be starting this week. We'll get some more information on more details about her, and we'll introduce you to her at our next council meeting, but she'll be starting this week.
Fantastic. And can you give a status update about the police chief announcement?
Yes, so we have gone out and reopened the recruitment, and so I've updated the flyers with some of that information for the council, and that information is out there, and we'll be accepting potential new applications.
Is there a deadline?
I think it's about 4 or 5 weeks, so it's a short period of time.
All right,
And I did have, Andrea has one announcement too.
great.
Hi, last council meeting, Councilmember Biala asked for an update on Chaparral Corporation, the concessionaire at the Equestrian Center. So just wanted to give you a quick update on that. We got into the agreement at the end of December, and so they have been in operation for about 7 months now. These numbers reflect the first 6 months, January through June. They ran a summer camp and hosted 49 children, 6 to 13 years old, over the summer. They have provided 134 private lessons to 6-year-olds to adults, 35 trail rides, 30 Little Ranchers, which is a toddler program, 2 to 5 years old, and over 200 pony rides in that 6-month period. So overall, they've served over 500 people. And they're really just ramping up, to be honest. There's a lot of infrastructure that we need to get in place for them to help them continue to build their presence. And we're working really hard on that. I'm working with Brian McCarthy. I'm sorry, you're Brian McCarthy, Brian McMinn, and really starting to build up the infrastructure. We've purchased some fencing so that they can have a pasture. We're working on taking down some of the older buildings, working on new bathrooms, ADA parking lot, a residential unit so they can have an on-site caregiver. So all of that is in process. I'm also working with them on a couple promotions. One is they have offered a 10% discount for anyone registered in our youth, teen, or senior centers. So anyone who is currently registered in those memberships will receive a 10% discount on whatever service they choose at the Equestrian Center. We are also reaching out to, have already reached out to CSUMB to do an open house for the students. They're coming back to school, I believe, end of August. So we're planning something in September. We don't have the date yet, but it'll be a general open house with some free, pony ride, horse rides for adults, some hay rides. We're going to have some cornhole out there, some fire pits. So that will be really fun. Another event, we have nailed down the date, October 28th, will be a fall harvest festival, and it'll be a very traditional fall harvest festival with bobbing for apples and costume contest. Again, pony rides. They're going to bring out a petting zoo. So really over the next few months, you should see them really ramping up, doing a lot more community events, trying to get out there a little bit more now that we have the infrastructure there to support those types of events. And as the infrastructure comes on board, you'll see more and more activity out there.
All right. Thank you very much,
Thank you.
Andrea. Any other information before we close? All right. Thank you, everybody. We'll adjourn this meeting, and I really appreciate everyone's input and work that went into it.